Could I ask, actually, the four witnesses responsible for pharmaceuticals, medical devices, but also the provision of healthcare, leading on from the scenario that Professor Harvey's just laid out of the UK becoming a third country, what is it in that scenario that keeps you awake at night, if you could summarise your worst nightmares?
So I should sort of kick off. So I think what Professor Harvey has laid out explains why we need a deal. And we absolutely need an implementation period as well. So our main concern is to ensure that we can continue to deliver the medicines that patients need, both here and on the continent, through this period. So that is the thing that we have been working the hardest to do.
Maybe to build on that, so indeed a deal is critical. So our biggest concern is that our company uses the British Standards Institute to CE mark, as the old kite mark, the vast majority of our portfolio and a lot of the industry's portfolio, and if we leave the EU without a deal, they will not be able to do that.
As a third industry supplier, sorry, I've got a bit of a cold. As a third industry supplier, what keeps us awake at night is the uncertainty of no deal. Without the medicines, and 50% of the medicines on average in most of our depots have been through the EU before they get to the UK warehouses. And this whole integrated supply chain that we rely on was clearly set up after we joined the EU. It's only in the last 20 years that it's been put in place. It's very sophisticated, twice-a-day delivery, almost just in time. We only have 2 or 3 weeks stock normally in a wholesale warehouse, and it's very dependent on supplies coming in when they say they're going to come in. So any challenge to that without an arrangement that makes a frictionless border will mean shocks to the supply chain. So we're worried about shortages, patients not getting medicines, and the huge price rises for the NHS.
And Safin Corbury is the person responsible for actually taking this stuff and delivering patient care with it. What's your worst nightmare?
So, a number of worst nightmares, actually. So I think what we think about are, healthcare is inherently a risky business anyway, and the uncertainty adds to that risk. So workforce supply, a huge issue. We know it's already pressured out there in the NHS. The timing of this is also critical, and the timescales. So I think that there hasn't been sufficient time for national level planning, frankly, and also, although it's speeding up now, and also the timing in terms of coinciding with other pressures across the NHS. We're approaching winter. We know that's a hugely pressurised time for trusts on the front line. We also know that trusts are doing their damnedest to meet their efficiency targets. They're going to have to take their senior time away from that and focus on planning for a no-deal Brexit. That doesn't put them in the best position. And I think that one of the things, colleagues here have talked about supply chain management. That is fundamental. Things like getting food into trusts is an issue. So we need to think about all of those elements. It's not just about medical devices. It's not just about pharmacy. It's about those broader issues as well. When someone is an inpatient, they are in the care of a hospital or a mental health trust. They need to be fed and watered.
Perhaps going back to the three gentlemen witnesses, can you give me some examples that would be meaningful to people out there, patients out there who rely on medicines or medical equipment, of things that might run dry, that there might be a shortage of, that we should be really worried about?
Well, I think if we look at the scale of this, there's 46 million packs of medicines a month leave the UK for the continent, and there's 37 million packs of medicines a month come back the other way. So we have a scale factor here. Also, if we look at the latest medicines which we are producing, they're almost all biologics, and they require cold chain storage. So that means they've got to be kept between 2 and 8 degrees from when they're produced to when they actually get to a patient. There are no cold chain facilities at the border ports, so that's why we rely on real frictionless trade to be able to move medicines quickly, and those are the things which clearly will give us challenges in the event of challenges at the border.
From a medical device perspective, our number one priority, of course, is to continue that supply of medical devices to patients and clinicians. But, for example, stitches, which are a central part of all medical practice and surgery, our company, Johnson & Johnson, supplies 69% of all stitches in the NHS, and they are CE marked by the British Standards Institute. So if they're not able to undertake that process, we don't have the authorisation to supply those stitches.
Domestically or anywhere?
Within, in fact, the entire European Union and also into the UK.
Nothing specific I would want to say, other than if you've read about the shortage of EpiPens, methadone in the past, it always can rise to the surface very quickly, any shortage, because of the just-in-time nature. I mean, I've got a I have a weekly list here of where medicines haven't been delivered to our warehouses. And this is 13 pages long, and that's quite normal. We work with the Department of Health to manage supply through the NHS where we can, because we can find product around the UK. So I'm just suggesting that the system would become very unbalanced very quickly if there's a shortage in any particular area.
So, I mean, how do you respond? I was on the radio this morning with Julia Hartley-Brewer, who is a well-known Brexiteer, and actually said she would rather like a no-deal Brexit, because none of this is going to happen. It's all scaremongering. We import stuff from the United States. Continental Europeans want to sell us their stuff, so there isn't really a problem here. How do you respond to that kind of claim that there's not a problem?
Well, I think that we would be all really abnegating our responsibility if we didn't plan for every scenario, because it's absolutely critical. So we might be saying there could be no problem, but fundamentally we have to plan for that problem, whatever happens. So I think that, we know that the supply chain, the workforce, all of the issues across the NHS are so interdependent.
But why would that dry up in a no-deal Brexit scenario? Just explain that to me in practical terms. Why would the stuff not come in?
My industry, then very simplistically, we have an integrated European supply chain. We have a supply chain which manages the Americas, and there's one which manages the rest of the world. So for any medicine that's brought in, it needs to be brought in under the licence that we have, which is a European licence. So to move outside of that requires a lot of work that has to be done. At the moment, everything has to come in through that way. Yeah. So if we suddenly find that we're not able to get our medicines through the borders, then we have real challenges, and therefore we have to be doing work now to prepare for that eventuality, to ensure that, should that happen, we have a way of getting the medicines to the patients.
And the same for devices?
Well, it's similar. So in the examples I was giving, there are solutions without consequences. So the solution is that companies that use the BSI to certify will start transferring their files to notified bodies within the European Union, so they can do the CE marking, but this has a multi-million pound price tag associated with it. And also those other notified bodies ask different types of questions, which has a risk of delay of the product being authorised in time.